Health Minister Dr Joe Phaahla has revealed that there are nearly 50 corruption cases in various departments across the country. According to the minister, 47 of these cases have been reported to police. Let's discuss this further. We're joined now by Deputy Director General for Hospital Services, Dr Percy Mahlathi. It's great to talk to you. Thanks very much indeed for coming on. So, 50 corruption cases, various departments across various provinces. How worried is the Department of Health?
Yeah, thank you, Michelle, and to your viewers. Certainly, corruption of any kind, worries, the department, especially that would be resources that should have been meant for the delivery of health services to the patients. So, but we're actually quite grateful that some of the cases are reported by fellow employees to say that, look, there is a problem here, and they get investigated, and so on. And like you said in your introduction, it's actually across the health departments in the provinces and in the different divisions.
Absolutely. And I suppose, the handling of these corruption cases and the people who are corruption accused is another discussion as well, Dr. Mahlathi, because in many cases, I would argue to say, in most cases, the officials in these cases have resigned, and then it's difficult for the department to take any recourse.
Yeah, I think that is one part which is a loophole in our legal system. And also, from a government point of view. But I must say that there are some instances where people would actually be followed even after they have resigned. For example, you would find that somebody, did something wrong and is reported to the police. That's a criminal case. What would be affected is a disciplinary case, because there are two aspects. One is a criminal case. The other one is for the employer to take disciplinary steps. Most instances where people resign, they're running away from a disciplinary case, but that does not nullify the criminal case. There has to be investigations by the security, forces, the SAPS, because as health we would not have the investigative capacity and capability, but from a discipline point of view, we can take action.
So the Eastern Cape is leading the pack insofar as the number of corruption cases are concerned, Dr. Mahlathi. When we talk 15 corruption cases in the Eastern Cape Department of Health, what kinds of money, amounts of money are we talking about?
Michelle, as we responded to a parliamentary question, we indicated that in many instances, because the investigations are going on, it's difficult to quantify right up front as to how much money is involved, in all those cases. And by the way, the fact that it would be 15 does not mean that those are the only cases. Those are the cases that have been reported and are being investigated. There could be more, even in other provinces where they would say there is none. It could just be that, no cases were reported in that period, which was January 2023 up to, at the end of the financial year. So that is not an absolute number, but we're just working on those that the provinces have reported to us. And in some provinces, they've quantified the numbers, and in others, they were saying that investigations are still going on.
Right. I wonder, Dr. Mahlathi, whether you have any insight into this, but what makes the Department of Health so susceptible to issues around corruption? Here in Gauteng, it's been quite a long-standing issue. The murder of Babita Deokaran, who was a whistleblower in the Department of Health, points to just how serious, how deep this issue of corruption is, so much so that people lose their lives. People who are trying to expose this kind of corruption are at very real risk of losing their lives. Do you think there's something within the department or something lacking within the department that makes it so susceptible to corruption?
Well, I would say that what attracts the vultures is the big budgets that we have. Health is one of the departments that has got big budgets. Gauteng alone, I think, must be sitting about 65 billion or so. So you would expect that there are people that will try every opportunity they can get to actually try and rob, the public of that purse. Secondly, is that I don't believe that the health department per se where has got people that have got, corrupt intent. The issue is that corruption is right across, where both public and private. And of course, people will sniff at the areas that have got big budgets, look for loopholes, where that they can be able to utilize, which is why there has been even much more closer cooperation now between the Department of Health and the law enforcement agencies. And I must say that our late colleague Babita Deokaran was actually a very painful experience, which showed that agencies of government actually have to work together to close the loophole, including the accountability that must lie with the leaders at institutional level.
Yeah, absolutely. I mean, it's sickening, isn't it, to think that money meant to go for the most vulnerable among us, people who rely on services in public hospitals, are deprived of that in many cases, in part because of issues around corruption. It brings me to my question around getting the money back, Dr. Mahlathi. When we talk about corruption and the many, many millions that we lose to corruption in South Africa, billions, how successful is the process of getting that money back?
Well, it would be difficult for me to speculate on that because that's always an end result of the legal processes. Somebody found guilty, in court, and the order would be to return that money, and the NPA then would recover whatever amount would have been stolen. In certain instances, you would actually get just a few people that would, in mitigation, return the money, that would have been stolen. So it's not an easy process because in a number of instances, you're not going to get that hard cash. It's been blown already, unless then NPA would go after the assets of the individuals. And that's a very lengthy process. But I think the most important thing is really to make sure that the taps are closed as much as possible. We know that people will be very innovative, find other ways, but it's important that we close the taps where we find that there's leakages.
Absolutely. Dr. Percy Mahlathi, let me thank you for your time. It is an ongoing conversation we're having, not just in the health department, but certainly across many, many departments in our country. But yeah, this was, according to Dr. Joe Phaahla, the health minister, it was a parliamentary response he was giving, talking about the number of corruption cases that have been registered in the health department. And this is just since January last year, and that's at nearly 47, I think.